Welcome back to another episode of Midnight Mental Talk. I'm Adrian, and my co-host is Leanne. This week we're going to continue on with our discussion about general practitioners and psychologists and psychiatrists, and therapists and stuff, and wait times, and possibly personal stories or just stories that we know about.
I can give you a couple of facts that I'd like to throw into this week's episode. I didn't get to last week. I read that it's estimated that 1 in 5 Canadians will experience mental illness in their lifetime, and the economic burden of mental illness on the Canadian healthcare system is significant and has been estimated at $51 billion among Canadians aged 20 and older. I will give a reference at the end of this video of what I am actually reading from. They also state that delays in treating mental illness can have several negative consequences, including deterioration in a patient's condition. Yet long wait times for mental health services remains one of the many challenges faced by individuals seeking help for their condition. Lengthy wait times may also be a barrier to access, as the longer times between initial contact and intake, it's less likely the patient will persist in seeking treatment, which is absolutely freaking true. I can say, out of my own experience, I have waited 6 to 8 months for a referral from a family physician to go through to a psychiatrist.
That's crazy.
Yes, and I mean, I am in Alberta, so I mean, in Nova Scotia and any other province, it could be different. However, have you had any experiences on wait times?
When back in high school, I did. I went to the general practitioner, explained my situation, and then ended up, I'm pretty sure it had to have been almost 6 months wait, because it seems like we actually had totally forgotten about it, and then we got the phone call saying, hey, you're going to set up the appointment. And this was when I was 17. So I did go there, and I did have the appointment with the psychiatrist and explained the situation, what's going on. And he did talk to my parents. And then we had agreed that I wanted to see a therapist on a semi-regular basis. But after that meeting, I had never heard from anybody again. So I was just literally like, that was it. So we're done.
So, and you didn't feel like pursuing it yourself at the time and at that age?
Well, yeah, it's like you're 17, you're like, well, okay, maybe my problem really isn't that sufficient for them not to be calling me back. But really, at the time, it probably was very sufficient, and it should have been looked at. But hey, I made it like 23 years later, 13 years later, I'm fine. But yeah, no, I've heard other wait times being extremely long as well. I've heard other stories where people have gone directly to the hospital, but then they were released again because they were discussed as if nothing was wrong, and then they had to wait for a doctor for them to talk to a doctor. But the wait times are pretty terrible. Where you had to wait so long in Alberta, when I had looked up the information, like I had mentioned to you earlier, the longest wait for Alberta is 25 and a half weeks.
Okay.
So, yeah.
However, if we discuss private psychiatrists and psychologists and stuff like that, when you've got $150 in your pocket, you're there next week.
Yeah, that's actually very true. However, when I was doing the research on private psychiatrists, it found out that Ontario has the most psychiatrists, but in the article that I had read, in Toronto itself, they will see about 181 patients, with it being 105 new ones, while the underlying ones, like smaller towns, will see a larger amount of people, like 431 patients, with 233 of them being new. Okay. So they're very selective, but you're right. If you have the money in your pocket, chances are you're there next week.
And, I mean, I can also attest that I did do that 6 or 7 years ago, probably. Sought out the private sector because I didn't want work to know at the time that I had to go to see it was a psychologist. So I paid out of pocket every time I went, and I did about 3 months worth before I was like, I can't afford it anymore. No. And you know what? I didn't gain anything from it. And here's the problem. And some advice I want to give people who may be new to seeking out mental help: if I could go back in time, I wish somebody had told me to make sure your doctor knows the exact health problem you have, that they're familiar with it, for one. And if you're going for, like, say, a health problem that isn't mental health related, like, say you're depressed because you've lost your leg or you've been in an accident, make sure they're familiar with that type of therapy as well, and that they have experience, and that they're going to take the time to talk to you and not rush you out the door or have their kid sitting in the hallway as you enter.
Their kid?
I went for my scheduled appointment. I arrive and I knock on the door. I take time off work. I go in and I see her child sitting on the bench, and she looks at me and actually has to cancel the session.
No, if you no. Oh, no. That's just awful. Like, you should not have to do that. If you're a psychiatrist and a psychologist, you should have the decency and then the compassion to call your patient and be like, look, emergency came up on my end. Can we reschedule for the next day or something? You just, no. I'd be like, no, bye, see you later. I'm never coming to you again.
I didn't.
Yeah, I wouldn't have. No, not at all.
I was quite frustrated. So you had earlier asked on Facebook or Twitter about wait times and what people thought would be, a good wait time, bad wait time, or their experience. Could you maybe tell us some of those?
Yeah, absolutely. So I went on Facebook and Twitter, and I had asked the general question of how long you think a wait time should be to go from a general practitioner to a psychologist or psychiatrist. Hi! And some people have responded, and one person said within a week, which it's kind of pushing it because they are busy. But personally, I think within the month would be very sufficient. Another person said within a month, but it's pretty shitty now. I agree, it is pretty shitty. Another person responded saying that their referral took about a week and a half, and which she thought was reasonable, and they schedule sessions every 2 weeks during the first visit. However, upon receiving her referral, she was warned that it could be 1 to 3 months. Right. It depends on the severity of the issue, and that is something I definitely want to bring up, that it looks like in all the research that I did in the wait time, it really does depend on the severity of the condition that you may be tackling. Another person that I know told her response was, well, you know my feelings, so the next day. So, and I agree with her. It depends on the severity. The severity that she had, or wasn't her, it was somebody that she knew. It should have been looked at within the next day, because it shouldn't have gone as long as it did. On Twitter, the response was pretty much generally the same. It's just basically the healthcare system in Nova Scotia is bullshit, and that you really need to advocate for yourself as well, because one person had mentioned that it almost cost a person in their life because it was an inadequate mental health care. So they said that and like I had mentioned in the videos before, you have to be prepared to fight for yourself. And I know it is very difficult. If you gun low enough, it's going to be very hard for you to fight for yourself and actually have the motivation and the desire to do so. If you think that they don't care, then you're not going to care.
And that is very true.
In that situation, if you know somebody who has a severe mental illness and they are trying to advocate for themselves, they also need a support team to back them up, like whether it be a mother or father, like even their grandparents, even a best friend or just an acquaintance, just somebody to help them back up, be like, look, you need to see this person and you need to understand that this is a problem.
But I will say I did get a medication from my neurologist in the meantime. But that's what's giving me the symptom complications.
Yeah.
And I'm afraid to call them and tell them, because when you look it up online, the symptoms I have are the ones that don't usually happen.
Oh.
Yeah.
You're at the 10% kind of spectrum.
Yeah, so I think he'll just say, nope, not the pills, stay on them.
Yeah, I can understand that. And chances are, yeah, he might say that. But or he could be a really like smart person and actually be sympathetic to your needs and be like, okay, well, maybe we should like do either a lower dose, like try a lower dose, see what that helps. A friend of mine went through the same situation. She's on one thing and it makes her shake. And she explained to them that she can't be on it because it makes her shake. Yeah. Like, I mean, like it's visible. And sure enough, they're trying it again, they try it again, and just like, yeah. They don't sometimes they really don't listen. Like, you know your body better than anybody else. So, they need to fucking listen.
And it is frustrating. Like you said, somebody calls up their doctor in the incident you just mentioned and says that about themselves, and the doctor seriously disregards it and says, continue the meds.
Mm-hmm.
I have had the same thing happen. Like, you sit there and you tell them how your body feels, and they will sit there and tell you, not possible, or or no, it's probably more like this.
My response to them would be like, are you inside my body right now? No, I don't think so. You can just shut up and listen to what I have to say. And the other thing is, they'll tell you, oh, that's okay. It will subside after a while. Well, what's after a while? Is it like 2 or 3 days, 2 or 3 weeks? It could be 6 months before it actually subsides. Like, who wants to live in that kind of situation for up to 6 months? Generally, a lot of the stories that I have a problem with is the fact that when you go to a general practitioner, a lot of times they don't just give you a referral, they give you a script. And they're just like, here's your prescription, you can go to the pharmacy and get it filled. This yellow pill with a happy face on it will make all your problems go away, which is never the case because it may not even be chemical that's wrong with the person. So I really have an issue with general practitioners giving out their scripts without guidance from a psychiatrist or a psychologist that is allowed to write scripts. I really, really, really don't think that family doctors or general practitioners should really be prescribing those meds unless they have a history in psychiatry. And if they do, then great. They should have that on their wall, and you should know that. So you have to know that you're in good hands. Like, just being told that, hey, have this pill, you'll feel better, it's not going to solve the problem. There's always something underlying that needs to be looked at. Mm-hmm. So my biggest beef is the number of antidepressants that come out of general practitioner's office on a daily basis. It kind of really needs to stop.
And I think that's a perfect segue into next week's topic. How about we discuss medications, side effects, and what's out there on the market today? Sounds
good to me. Okay. And there's a lot on the market today.
Yes.
There's one popping up every so often, like every couple of months.
So thanks again, everybody, for giving us a watch. Please comment if you've got stories similar to ours, or if you'd like to see us discuss anything specifically. Don't be afraid to get in touch with us via Twitter, via our email, or comment below in YouTube. Next week's topic, you heard it here, is going to be about all the drugs on the market today for depression and various other mental illnesses. So, thanks again, Adrian, for doing the chat, and we'll talk next week.
Absolutely. See you later.
Bye.